current predictions of climate change and its impact on health, on people, are even half accurate, and I think there would be no one here who would think they won't. We may well see in the coming years a confluence of issues around the environment, health, human rights.
I think it's very timely that we should have this meeting bringing together the issues of health and climate change. I'm very proud to be part of a really fantastic team that works all over the world, both here in London with Project London, which has itself won an Excellence Award this year.
I'm going to talk about the links between climate change and health in a number of different categories. I'll say a few words about climate change itself, then I'll try to summarise the potential health impacts of climate change, say a few words about adaptation, and also about mitigation, by which I mean strategies to reduce greenhouse gas emissions and at the same time improve public health. It's important to recognise, we've already heard, some communities are particularly sensitive or vulnerable to climate change, small islands being one of them. Many small islands, their fresh water depends on a thin lens of fresh water which essentially floats above the seawater, and as seawater rises, that lens of fresh water may become displaced and the island may become uninhabitable. It would be unethical not to try to adapt, particularly to promote adaptation amongst the poorest populations. Looking at the relationship between diarrheal disease and rainfall, and they found overall a 4% increase in diarrhea incidence in young children per 10 millimetre per month decrease in rainfall. So there does seem to be this empirical relationship. Not entirely clear why that is so. There is some evidence from other research that perhaps hygiene interventions such as hand washing and so on have a reduced effect where water is very limited and where rainfall is low, probably because people are conserving water and therefore they're not using it for hygienic purposes.
We know that climate change will contribute to new and varied risks to human health. This is something that Andy spoke about. The extent to which we can understand those risks differs according to who you speak to, but we all know that that contribution is there. In fragile contexts, again, as he spoke about, which are unable to cope with health needs, these risks will place a further burden on already weak systems. There are a number of faces that I hope you'll be able to catch up with during the lunch break. A number of people who've been out in the field with doctors of the world, and a number of them can talk about the already weak systems that we're talking about here. And no one is surprised by the example that he gave of the contributions being very high in countries which feel the consequences in very small ways. The other issue is that when you look at relative poverty, the countries that are affected are, of course, the least able to deal with those. In certain circumstances, the additional burdens posed by climate change can interact with other factors which overwhelm the coping capacity and can lead to increased risk of political instability or violence. A couple of traps to avoid falling into. Number one, it can be, as it probably is for many of us sitting here, it can be overwhelming to look at these consequences, to look at the links between climate change and health are bad enough, but then if you think climate change and health and conflict, now you're really starting to get overwhelmed. The other thing that we need to concern ourselves with is that we aren't being too quick to see connections where those connections are very weak or are very difficult to document, because that's when you play into the hands of what was referred to before, a very media-savvy group of people who want to undermine the whole movement to tackle climate change.
In particular, I'm going to examine three questions. First, is climate change forcing people out of their homes? Second, how many migrants can we expect? And finally, where are they going? And I can already give you the answer to these three questions. And the answer is very brief: we don't know. We don't know, but we have to examine. We can only have estimates, and we can only have ideas of how these questions could be answered.
The figures that we were just hearing about the, Myers estimate about 1 in every 45 or whatever being displaced by climate change, I mean, would certainly exceed what's believed to be the current global migrant population. and that's estimated to be about 192 million at present, about 3% of the world's population. And that's been a fairly steady percentage over quite a period of time, although of course the numbers have risen because the world's population has risen, which may also be one of the factors when we're looking at which countries are particularly affected and their ability to cope with that.
5 years ago, health was not focused on climate change at all. Maybe one or two honourable exceptions, like Robin Stott, who's been beavering at this stuff for 20 years, but I can assure you, as far as the health establishment was concerned, in both the OECD countries and in developing and emerging economies, there was no focus on climate change at all. And you look at it now, and you have to say that the contribution being made now by the health community broadly, both through academic journals, through research work, through interventions with policymakers, on-the-ground interventions and so on, is enormous. Climate change will either destroy everything that the human species hopes for in terms of a better world, or it will bring humanity together like no other conceivable set of circumstances could do. You can't have a rich world solution to climate change that doesn't embrace poor world contributions, solutions, strategies and interventions. It's not possible. The old-fashioned way of dealing with this in the West, which I basically summarize as fortress civilization, which is actually we've always wanted some excuse to build the walls higher and keep out all those poor people. What have we got to do with them after all anyway? And we have a lot of fortress mindsets in the rich world today, a lot of them. They don't come out in public very often, but there are a lot of people who basically think, yeah, well, we're never going to be able to deal with that, so guess what, we'll build a higher wall. We either work together to address this challenge, or we will fall apart. We can't do this on our own.
Thanks very much to everyone for coming this day.